Well, people just want to feel good about themselves. There's no shame in looking good. People want to feel the best they can. A lot of my patients are mothers who remember what their body looked like when they were 20 or 25. And, children have a way of, negatively affecting a woman's body. So they want to recapture that, and as they should. So generally, people just want to feel good about themselves.
Hey, everyone. Welcome to the Discover Virginia podcast. I'm Joseph Trahan, your host for the #1 video podcast in Virginia, where we explore the rich history, vibrant culture, and iconic businesses that make our Commonwealth truly special and worth talking about. So get ready as together we discover Virginia. Welcome back, everyone. I'm your host, Joe Trahan, and today we are joined by Dr. Michael Denk, board-certified plastic surgeon here in the Virginia Beach area, but also serving the Norfolk area as well. Plastic surgery, so good your mom would approve, and she might even consider getting herself. Dr. Michael Denk, welcome to the podcast.
Thanks, Joe, and thanks for the repeat of the line. We do like that line.
Absolutely. It's a great line. And today, for our folks just now tuning in, we're going to be covering the ins and outs of the plastic surgery industry, as well as tackling some of the stigma that we might find in this particular niche, as well as the top 3 procedures you might likely see happening during the 2024 year. And of course, Dr. Michael Denk to guide and lead us through his skills and experience, as well as his firsthand knowledge of how to equip and empower his clientele.
Thanks, Joe. No, thanks for having us. Excited to be here.
Yeah. So, Dr. Denk, I would like to first start off this conversation by clearing up some of the terms. And there's a lot of information as well as misinformation out there in the plastic surgery world. Now, you yourself have nearly 3 decades of experience in the world of plastic surgery. Can you share with us what exactly is a board-certified plastic surgeon and the work you do for your patients?
Sure. So a board-certified plastic surgeon has completed medical school, which is 4 years, and then anywhere from 3 to 5 years of general surgery. In my case, I completed 5 years, which is a fully trained general surgeon. Then most plastic surgeons will go on for 2 to 3 years more just in plastic surgery. I happen to go 4 years more in plastic surgery. And then after you complete your training and you start working, you actually accumulate your cases for the first year or 2, and then you take a series of exams. The first exam is a written exam to be board certified. The second is an oral exam where you actually defend your cases. In my situation, I sent in 100 cases, including all the notes, all the billing information, all the photos, and then the board chose 6 of those cases for me to defend. And then you go to a location. In my case, I went to Philadelphia, and you sit and defend those 6 cases in front of 2 examiners in each of 3 rooms. And then they also give you unknown cases. So it's a 2-day process.
Wow, that sounds very intensive. I mean, as we would want to expect from our medical field, right? It's very much due diligence and due process. Now, growing up in Buffalo, New York, I understand you originally didn't actually want to be a plastic surgeon originally, but you wanted to do something in the hockey field.
Yeah, I was a keen hockey player. I mean, I was a keen athlete from the time I was 10. Even younger, baseball, soccer, hockey. But I really went to college to play ice hockey. I played on a team when I was 16 and 17. We used to play 100, 110 games a year. And all the guys on my team went on to college to play ice hockey. So that was plan A.
Yeah.
And that I played for 4 years in college, but about year 2, I realized, I wasn't going to become a pro hockey player.
Sure.
There was a young kid from Montreal who took my jersey. He was a year younger than I, and then he went on to play with Wayne Gretzky and won a couple Stanley Cups. So it was a good handoff, and then it was a time for me to sort of redirect my energy.
Yeah. Wow. Well, what a very cool season. And we'll talk a little bit more about your later in the conversation about your activities in the ice skating rink, because I know it hasn't yet ceased in that passion and love for that. But I know you've talked about the nature of your work, before requiring, this level of creativity. What does creativity mean to you, and how do you allow it to influence the way in which you work with your patients?
Well, I mean, creativity, a left-sided brain, function, it's the juice that keeps us fresh.
Mm.
I just celebrated a birthday that is a pretty large number, and I don't feel that large number at all. Partly because of the creative side of my practice. Some of it is relational, relating to people as young as 19 and 20 and as old as 92. And then some of it is procedural. You talked about, the technical part of plastic surgery.
Yeah.
The one thing that's nice about medicine, specifically plastic surgery, you're always trying to do something better. And you're trying to do it better for the patient. So each and every time you do a procedure, you not only want to do your best, you want to do what you did better the year before, 10 years before, 20 years before. So in some ways that challenge is, keeps you creative.
Absolutely. Absolutely. Now, I understand for your specific practice, you do service the Virginia Beach and Norfolk, Virginia area. You offer a very personalized service that in many ways restores and empowers someone to be their better self, to be their best self. What are some of the common motivations your clients have when they come to you initially?
Well, people just want to feel good about themselves. There's no shame in looking good. People want to feel the best they can. A lot of my patients are mothers who remember what their body looked like when they were 20 or 25, and children have a way of negatively affecting a woman's body, so they want to recapture that, and as they should. So generally, people just want to feel good about themselves.
Absolutely. And because you have such an extensive knowledge of the field of plastic surgery, you have a wide range of services. And I know that we could probably spend all day talking about those different variations. But for today's conversation, I would like to cover the top 3 procedures. In fact, in an earlier video you made this year, you predicted 3 trends you might see in 2024. And I'm curious if they're still the case. First one is liposuction. Second one is breast augmentation with the fat or with implants. And the third one is tummy tucks, not just for moms, but traditionally we see with moms. How's that prediction been so far?
It's pretty spot on. Liposuction is as popular as ever. There's a technology called Vaser technology. It's a liposuction with an ultrasound probe that helps us define and shape thinner people as well as trimming up heavier people. So liposuction is definitely on top of that. Tummy tucks are right there behind it. Most every tummy tuck I do involves using liposuction. A tummy tuck is at least 3 or 4 things, one of which is removing skin and fat, one of which is, liposuction of the waist, and 3 is actually tightening the tummy muscles that have been stretched or pulled from pregnancy. And as far as breast augmentation, still as popular as ever, at least in our area. I think nationwide, smaller implants are definitely more popular than they have been, and certainly natural, fat grafting of breast. I've done much more of that this summer than I thought I might. And again, it lends itself toward shaping and contouring someone's waist and legs, and then using that fat to add some volume to their breast.
Yeah, absolutely. And when it comes to those 3 specific types of procedures, I'd love to kind of land the plane here for a moment and kind of chat with these over some popular questions. Would that be all right?
Sure, absolutely.
Yeah. When thinking about liposuctions, many people just think about the tummies first, but you shared that this is no longer the only use for them, and there are multiple variations of this procedure. Can you share more about this statement, and what are the main differences between traditional liposuction and techniques like tumescent, ultrasound assisted, and of course the laser assisted liposuction?
Right. Well, I mean, liposuction has been around for quite some time, and again, it continues to evolve, not only in the results but also in the recovery phase. And the sites that can be liposuction are literally from head to toe. The jaw can be liposuction, the neck, under the chin, the arms, the back, all the way to people's ankles. There's no limit to where we liposuction. There's a phrase called liposuction 360, which is a popular social media phrase, which probably doesn't quite do the term, doesn't do the specialty justice. It's really circumferential liposuction,
Okay.
where we would lipos someone from their breast down to their pubic area and from their armpits down to their buttock, on the backside.
Sure. So like a particular region of area.
Right. Well,
Yeah.
and again, circumferential around the entire trunk.
Right.
In general, the closer someone is to their ideal weight, and the more areas you liposuction, the better the results are going to be.
Sure. Sure.
And then there's that other side of liposuction is once you harvest the fat or remove the fat, can you do something extra with it?
Right.
And that's where fat grafting the face, fat grafting the breast, fat grafting the buttocks comes in.
Right. Because you have the ability to reutilize those parts elsewhere.
100%.
I'm curious, how do you determine which type of liposuction is best suited for a particular patient?
Well, in general, this Vaser technology liposuction is the best on the market. And for me, I've used it almost a year now, and it certainly provides me with better results. Not only the actual result, but there's less pain, less bruising, and a wider range of age and body types I can treat with it.
Oh, very fascinating, especially when you consider just the range of potential that you can do. Does liposuction help with cellulite or those areas that just aren't responding to, traditional diet and exercise?
So cellulite is a very common occurrence. At least 80% of all women will get cellulite, which is simply just cords pulling the skin down between the subcutaneous fat and the skin.
Mm-hmm.
Liposuction can treat those. Nothing treats them 100%. But
Gotcha.
if somebody is troubled by liposuction, let's say on their buttock or their thigh, at the time, if someone is troubled by cellulite on their buttock or their thighs, at the time of liposuction, I will literally take a small needle or a small knife and clip each of those cords, and then liposuction after that.
Oh, wow.
And in the buttock, we can release those cords and place fat there's a product named Renuva. It's a human product that does not have any antigens, doesn't have any negative things in it that actually stimulates fat growth. So we've been treating a lot of patients who don't want more volume in their buttock. They may want their hip dips a little bit smaller. They want their cellulite lessened, and releasing those cords using this product off the shelf that's called Renuva has been a great way to do that.
Dr. Denk coming out with some rapid fire workarounds for something that traditionally people just, might just settle for, and a lot of times, but it sounds like there's some opportunity.
Well, there's no doubt. Plastic surgeons are out to serve their clientele, and it's the patients who, they're the one who push us.
Right. And that's what you want for your industry too. You want to be challenged and really, in a safe and ethical way, really figure out exactly how to mitigate those risks and also make the results happen. Right?
No question. People, I started out doing reconstructive surgery, first doing children, then doing breast reconstruction. And a lot of physicians, and I think public, say, well, cosmetic surgery, that's easy. Anybody can do that. It's actually just as difficult or challenging or even more challenging than reconstructive surgery because the patient's expectations are so high that managing their expectations, meeting their expectations, it's a worthy challenge and something anybody who does primarily cosmetic surgery takes seriously and enjoys it.
Sure. And speaking of expectations, the next one I want to dive into is breast augmentation, which of course has lots of, conversations and, things that we'll dive into later as far as the stigma goes. But I understand with the, in terms of the augmentation process, clients can achieve, various outcomes based upon their preferences. As you mentioned before, really pushing those boundary lines. What options do you offer for your clients to choose from when it comes to the breast augmentation?
So, breast surgery is a whole book, right? There are patients who solely would like just a breast lift without any augmentation, without any enhancement. If somebody wants to increase their size, there's essentially 3 or 4 options. Option 1 is using their own fat, if they have some on their waistline or on their thighs. Number 2 is using an implant. The breast implants worldwide have about a 95% satisfactory rate with patients. There are silicone gel implants and saline implants, and there's benefits to either. And then there's the occasional patient who may want an implant with a little bit of fat on top. If there's not enough breast tissue to hide the implant, it's nice to put a little icing on the cake with fat, say primarily in the cleavage area.
Sure.
So those are really three techniques: fat alone, saline or silicone implants, or an implant with some fat as well.
How is 3D printing currently being utilized in plastic surgery?
Well, we don't use it. Certainly, you have to be a little bit of an artist, I suppose, to be a plastic surgeon. But it's really about conveying expected results to patient.
Sure.
Some people use 3D imaging all the time. There are plastic surgeons that do it. For me, I've always said to patients, if I can't have a conversation with them and explain to them what they're going to look like, it's a failure on my communication.
Sure.
On the other side of things, if I print out a 3D image of what they're going to look like, well, then that's exactly what they expect to look like. And sometimes, that raises expectations to a point that's unrealistic.
Yeah. What are the common incision techniques for the implant placement, and how do they affect scarring and recovery post procedure?
So again, Joe, it all depends on how much loose or excess skin someone has.
Okay.
Ideally, if someone is just smaller breasted and they do not have any loose skin, an incision typically 1.5 inches or so below their breast in the inframammary crease, in that area below the breast as the breast meets the tummy. One incision there, 4 centimeters, 1.5 inches, 2 inches at the most. And that incision will not change the function of the nipple. It will not change the function of breastfeeding. We don't go through breast tissue. And when a patient looks at herself in the mirror or looks down, you can't see that incision.
Sure.
That is definitely the primary incision. If someone has excessive skin despite putting an implant in, then we need to tackle that problem and to tighten skin. And typically, the incision is made around the areola. A lot of women have more generous areolas than they want after childbirth. So taking some skin and hiding the scar around the areola is a typical thing to do as well.
Are there any myths about breast augmentation that you want to set the record straight on?
The biggest thing is that plastic surgeons, I think for years, have recommended certain sizes to patients. The way I practice medicine, I want it's about what the patient wants.
Right.
I equate it to shopping, and truly the best thing about a breast augmentation or breast surgery in general, if a patient can think of it, I probably have done it and I can do it again. And the size is totally up to the patient. Now, there are patients that I'll talk down in size, and there are patients I talk up. I just refused to do a young patient who traveled quite a ways to see me because the size implant she wanted was really not a good choice for her at her age.
Sure.
So, for me, I think the number one myth is that, plastic surgeons just take it out of the cupboard and put in the biggest implant they can.
Right.
Those days are long over. Women want manageable, perky, maybe even fun breasts. Most people don't want to be a breast. They just want nice breasts.
Yeah.
Hey everyone, Michael here from behind the camera. Right now we're taking a quick break to acknowledge and thank our wonderful studio host, Atlantic Bay Mortgage Group. When it comes to getting information and guidance on financing your next home purchase, we recommend talking with Atlantic Bay. They are one of the original lending institutions in our home city of Virginia Beach, and have a long resume of getting the job done well and making your home buying experience more enjoyable. So, if you're looking to experience Virginia full-time, consider checking them out today at www.atlanticbay.com. Disclosure: loan programs may change at any time with or without notice. Information deemed reliable but not guaranteed. All loans subject to income verification, credit approval, and property appraisal. not a commitment to lend. Atlantic Bay Mortgage Group, LLC, NMLS number 72043, NMLSconsumeraccess.org is an equal housing lender. And now, back to today's show.
Now, your services also cover, for a specific clientele. It's not exclusive to this one, but, it's most definitely more popular in the area for moms, and that's going to be tummy tucks. What specific benefit does tummy tuck offer to postpartum women?
So most postpartum women are troubled by this stubborn lower abdominal fullness, bulge. Some of that is related to the rectus muscle stretching longer than they were and also stretching wide. Mm-hmm. And again, that's the functional part of a tummy tuck as well. Muscles that are stretched out and separated. A separated abdominal muscle is called the diastasis recti, but in general terms, the muscles are just too long. So shortening those muscles not only lets them wear a pair of jeans or a tight skirt, it also helps with posture. It helps with bloating. It may help with bowel function. So a tummy tuck can be a functional operation. It also changes the contour, obviously, of their waist, lower back, and lower tummy. It lets, not to be too forward, but I mean, there's a lot of young gals who are in their 20s, 30s, and early 40s. Their goal of a tummy tuck is to get into a pair of tight jeans or even a two-piece bathing suit,
Sure.
which I certainly
Your
share
goal
with
is to
them.
help enable the patient, right?
Absolutely.
Yeah.
Hidden scar, great looking belly button, flat tummy, and in their words, a tight waist.
Yeah. Can you combine a tummy tuck with other procedures such as breast surgery for more comprehensive, I'll use the term, quote, mommy makeover?
Absolutely. No, mommy makeover, yeah, I think is a great word. I know some of the guys in New York City are not keen on that terminology, but again, what organs are affected by motherhood the most?
Yeah, absolutely.
Tummy and breast. So I think a mommy makeover is quite fitting. I do a lot of that at the same time. The recovery is pretty quick. It's certainly less expensive for somebody to go through breast and tummy at the same time. And with a mommy makeover, it's simply an operation on your tummy, an operation on your breast. The operation on a woman's breast may just be a breast lift, Joe. And certainly on a tummy tuck, I may liposuction someone's entire back and their waist and do a tummy tuck as well.
Wow.
So a lot can be. There's a lot of
Yeah.
options, and there's no cookie cutter mommy makeover. It's really what the patient wants and what her anatomy,
Sure.
what her anatomy brings, and what her expectations are.
And I think that question is popular for a lot of reasons too. In addition to the term, is like, how much can you do at one time on your body before it is too much, right? And that kind of leads me into my next question. What advice do you have for women considering, getting a tummy tuck to ensure they achieve their best results, whether they're having the traditional just tummy tuck or doing the mommy makeover and wanting to still be able to have a more quick turnaround
Right.
time?
Well, one of the best things about social media, now I'm sure you know this yourself, for a plastic surgeon, my Instagram accounts are a catalog of what I can do.
Right.
So there are before and afters on there. And for somebody to go and find, and this is what my patients tell me, I try to find somebody who looks like me before and somebody who looks like me after. And there are, hundreds of patients of mine in the last 2-3 years who have followed me for a year or two before they even come to see me.
Sure.
So
yeah.
my advice to women is, be comfortable of who's going to do your surgery. Social media gives you a great way to try things on with someone. You certainly can get to know a plastic surgeon with a virtual consultation. And I would go with your feeling, with your gut, that you're comfortable with your plastic surgeon and see 2 or 3 or 4 until you are.
Right, absolutely. And you have an extensive catalog of the work that you've done. And as you mentioned before, just give patients that extra boost of comfortability and also
Absolutely.
just the experience of what you've done so far.
And for a patient to be comfortable, gosh, take your mother, take your husband, take your girlfriend to the consultation, because they will only help, you foster that relationship more.
Absolutely, absolutely. Just the goal to empower these individuals and to find out exactly what it is they're looking for.
Well, I mean, life's about relationships, Joe, and
Yeah.
the relationship you have with your plastic surgeon and I have with my patients is precious to me. It's invaluable.
Absolutely. And in the community you've built overall, that's kind of where we're going to have our next conversation. The community is important in fostering that credible information and breaking a lot of stigmas out there, because there are stigmas around plastic surgery. I want to open up that dialogue here for a moment to get your take. Would that be all right?
Sure.
So there's a big concern around health and safety of our bodies. What health risks exist when undergoing any form of plastic surgery, or some people might refer to as body modification, and how do you, as an experienced, I highlight the word experienced here, board certified plastic surgeon, really go out about mitigating those risks?
Well, I think the number one risk is general anesthesia. Once a woman says, "Oh yeah, I definitely, Dr. Denk, I want to go with a tummy tuck. I want to go with you," the next thing they ask is, "Tell me about anesthesia. What are the risks of anesthesia?"
Right.
We use physician anesthesiologists only in our office. The nice thing about my office operating room is I get to pick the anesthesiologist. I get to choose the staff who works the operating room. It also so happens to be across the street from the Virginia Beach General, just in case. So, the safety of the OR is important. And what I typically say to patients is, if I take the typical 35 to 55-year-old woman who takes no medication or maybe takes a mood elevator,
Right.
that patient has about a 1 in 300,000 risk of having a catastrophic event. A patient or myself or you, Joe, today has
Right.
about a 1 in, a 1 in 60,000 risk of getting in a car accident. So the risk of general anesthesia really is about a fifth the risk of driving a car.
Right.
So in general, it's very safe. But again, making sure the patient's medical condition is excellent. If not, I have them see their family doctor or their internist beforehand. So safety first, safety
Absolutely. And that's the beauty of the Virginia Beach, Norfolk area. We're not in any short supply of certified, well-equipped, and well-versed, medical professionals for sure.
No, we're fortunate that way for sure.
So when it comes to the peer review side, I want to highlight this next for you and kind of dig into this statement. So there's an excerpt, and I'd like to get your opinion on it. It's from the Journal of the American Society of Plastic Surgeons, in reference to, stigmatization of the field. Perhaps the first step is to admit its existence. There is some resistance to accept this view in academic circles, and one possible factor is plastic surgeons are somewhat reluctant to admit that their work may be controversial or stigmatized to begin with. Individuals who choose to undergo these procedures often find themselves condensed to or shamed, and even accused of having psychological problems, which in turn influence them to hide or deny that they had undergone, quote, the knife. Many celebrities, considered cultural icons or, features of natural beauty, are outed years later in their career in, demeaning and salacious manners by the media, as if the surgery is a shameful secret in their past. This part I really am curious about, Dr. Denk, from your perspective.
Right.
Beauty is not skin deep, and cosmetic surgery is not superficial in terms of its impact on patients' lives. It often addresses psychological issues that are deeper and more complex than just pure aesthetics. Evidence has shown that patients who undergo these procedures enjoy benefits such as improved sex lives, self-confidence, and self-image. No, I threw a lot at you, Dr. Denk.
You did.
I want to kind of summarize here. There's a big push when it comes to the importance of processing this body transformation. When it comes to that general process, what are some of the conversations or possibly the context you have with, patients before they undergo the procedure, just to be mindful and aware of when it comes to addressing that stigma?
Well, it's a big topic, Joe, and I'll take it, a little bit at a time.
Absolutely.
In a consultation with a patient, the first thing I do is to ask them, what would they like change the most? If they had one thing to change, what would it be? And some people have a very hard time with that. They want to tell me 6 things, but I always make a patient come up with a priority list, and we go through 1 through 5, 1 through 4, whatever their list is.
Right.
Now, I may only get through the first 2 with the first operation, but, listening to them. And I think that the thing that I think the whole world needs to realize is that plastic surgery is only for the patient. And we live at a time when there's a lot of envy, and people want to know why does she look so good? Why does he look so good? What did he have done? I mean, it's 20 years ago, gosh, 80% of patients didn't want to tell anybody. I find that today, at least 50 to 60% of patients are happy to share what they've had done. Mm-hmm. Now, I don't operate on any celebrities,
sure,
for better or
that
for
you're
worse.
allowed to disclose.
Yeah, for better or for worse. Yeah. But again, plastic surgery is for no one but the patient. And certainly I've been in a situation where patients, families, friends, and otherwise have tried to talk them out of plastic surgery. But I think we live at a time where, number one, plastic surgery results are getting more and more natural, and there's a lot of guesswork to know if somebody's had something done.
Right.
And the better we get technically, the harder it's going to be to tell. And I think the more socially acceptable it's going to be, because people won't look odd or different. They'll truly look better. And I don't think there's many people who don't want to look better,
Sure.
There are study after studies that show the attractive child gets better grades. Why? Because the attractive child gets more attention. You don't need to be attractive to be successful. You don't need to be attractive to be happy. But at the same time, there's nothing wrong with feeling good how you look.
Yeah, absolutely. Dr. Denk, well said. And I appreciate you sharing that, because it's definitely one of those conversation topics that is, I believe, important to have for any person considering this, just the amount of depth and scope you have as far as your experience goes for preparing people for all of the different types of expectations and the results.
Well, I mean, a patient's trust is, at the end of the day, is the only thing I have.
Yes.
And that, I cannot ever take lightly.
Absolutely. Now, you've alluded to this several times before, and I just want to, highlight again, when it comes to, fostering a community relationship is important to you for not only in your line of work, but also for your local community. And I'd love to highlight your ice skating bit here, because it's super cool. I understand you keep up with your hockey skills and, put Wayne Gretzky to shame, on a more hyper local level, here in the Norfolk, Virginia Beach area by participating in the Eliza Hope Foundation, where the goal is to skate 100 laps. Can you tell us more about this work?
Well, again, I have no hockey skills at the moment. I could go out and play if I needed to. I played in an alumni hockey game about 6 years ago, but I can skate. It's kind of like riding a bike. Once you know how to do it, you can do it. So Eliza Hope Foundation is named after one of my patient's daughters, who was unfortunately lost her life at a very young age. Amy Darby and Aaron Darby are her parents, and Amy was and is my patient, and is just a terrific woman. And they have a yearly skate-a-thon where in an hour we have to skate 100 laps. So I've done it maybe 3-4 years now, and it's the only time I skate, but it is fun to do. And thank God I have some cheerleaders there. I offered my tennis group an opportunity to come throw tennis balls at me while I skate 100 laps and I think next year they're hopefully going to take me up on it.
Did they take you up on it?
Not yet, but I think next year they're going to do it.
Yeah. Tennis people, it can be a little hard to persuade sometimes. Yeah.
Well, I mean, that's my main sport currently.
Yeah.
But I like to still think I can, ice skate. So the once a year is awesome. And it's a great organization. Their center is just around the corner from where we are. They target preschool children, on the spectrum, and really are supportive of the children and the families.
Very, very cool. Well, Dr. Denk, we really appreciate your time. We know you have lots of appointments and procedures and also consultations lined up. So we just want to have one more opportunity to spotlight all the work that you're doing with the final red carpet section. But before we get to the red carpet section, we do have some rapid fire questions
Sure.
for you to get through.
Sure,
Are
sure,
you ready?
Sure.
Okay. First question. How do you feel about Dr. Miami? I heard he sounds like Michael Scott, but not in a good way.
Well, I mean, he's entertaining, and as my youngest son told me when I started this whole Instagram thing, he says, "Dad, it's supposed to be fun."
Yeah.
So he's fun. And, Miami gets a bad rap in plastic surgery, but there's a lot of very good plastic surgeons in Miami. You just have to seek them out.
Sure.
But I think he's brought a fun side to the specialty, which it needs to come out.
Yeah. From your Buffalo days, I'm curious, do you still remember the Buffalo State flag colors?
Buffalo State flag. Well, the Buffalo bleeds red and blue because of the Buffalo Bills.
Okay. I'll take that answer. Yes. When it comes to, the procedure process, there's a lot of, questions people have in the OR room because most of the time everyone's, knocked out on anesthesia and there's just the procedure workers. Do you guys listen to any music? And
Always.
If so, what type of music
Always.
do you like to listen to?
Well, for years, my opening song was something by Earth, Wind, and Fire.
Okay.
I like a wide variety of music. Today, we probably listen to more pop than anything.
Yeah.
My youngest son is managing a couple pop singers, so we lean that way a little bit. But it depends on the procedure. If it's going to be a 4-hour case, there's nothing better than 70s, 80s rock music.
Sure.
Because
yeah.
we know the songs. It's not too distractive. Doing liposuction, it's nice to have a little bit of hip hop and a little bit of rap. When I do a facelift, we maybe delve back to Broadway hits or maybe the 60s, 50s, and 60s.
Very, very cool. Last one for you. Are you able to make any comments or give us some insight into your secret garden life?
Oh, well, absolutely. My mother was a huge gardener, and one thing about gardening, unlike a plastic surgeon where you're doing something to get a certain result, in the garden, you're an observer. You can try to tame it, you can try to grow it, but you're really just there to observe. So gardening is a great way to come out of yourself, let's say mental health,
Yeah.
because the garden always wins. All you are is a observer with a clipper.
Very insightful analogy. I like that. You're just a clipper, observer. Love it. Dr. Denk, thank you so much for your time. We'd love to roll out the red carpet for you. Please share this camera here. Any final words or messages that you want to leave the audience with? The floor is all yours.
Well, I'm blessed to work in a field that, I love. And plastic surgery is an awesome career for me. And again, plastic surgery, as I said earlier, is only for the patient. And if you can do something to help your self-esteem, it's going to help your life and at least 10 or 15 people around you lives if you're happy and your back is straight and you're proud. Thank you so much for having me, Joe. It was just a pleasure.
Thanks for being on the show.